Hello, my name is Valerie Gutmann Koch, and I'm going to preview my work in progress, Previvorship, and the legal doctrine of informed consent. In this project, I introduce the concept of the previvor to the legal literature. I do so in order to evaluate whether current law and policy is adequate to addressing the changing circumstances of medical decision-making as exemplified by the previvor experience. So what is a previvor? Well, the term developed in response to an identified need within the population of individuals with mutations in the BRCA genes, which can confer an elevated risk of breast, ovarian, and other cancers. In 2007, the term made Time Magazine's top 10 buzzwords list and is now ubiquitous today. However, this definition that's most commonly offered in the popular media is almost exclusively limited to individuals with mutations or a mutation in the BRCA genes. The current limitations of the term previvor is problematic for law and policy as it applies to medical decision-making and access to medical and scientific resources. In particular, the vast amount of research and knowledge as it pertains to BRCA mutations can be contrasted with the dearth of research and resources that are developed to studying other hereditary diseases due to systemic bias inherent to the clinical research arena and medical treatment and disparate resource allocation. I therefore propose a definition that aligns with conceptions of medical and legal justice and includes all individuals with a hereditary mutation, a family history of a specific disease, or some other predisposing factor to disease for which preventative action can be undertaken. In other words, the definition of previvor must be inclusive of all individuals with a known clinical actionable risk to a life-threatening, severe, or chronic illness or condition. And extending this definition is one small step towards ensuring fair and more just treatment of those who learn they have a genetic predisposition to disease. After defining the term, I examine the role of the previvor within the greater context of the provision of medical care and individual decision-making. The previvor experience challenges many of the basic assumptions underlying the traditional understanding of medical decision-making. In many ways, previvorship is a category that defies the traditional boundaries of medicine, and the previvor identity is distinct from the long accepted conceptions of what it means to be a patient. The advantage of adopting a label such as previvor can be empowering, and self-identification can make previvors feel less alone. A previvor is part of a community of similarly situated individuals. Adopting the previvor label can reveal an important shift in identity. Non-symptomatic or perhaps never symptomatic individuals become patients by virtue of a lab test, seeking medical treatment or surgical intervention that normally are reserved for the sick. In the context of previvor decision-making around which, if any, prophylactic interventions or actions to accept, reject, or delay, I distinguish between risk and uncertainty. I examine the unique circumstances that previvors encounter when weighing the risks of an intervention and which interventions to undergo and why. Numerical risk is only one aspect of an individual's decision-making around whether and when to undergo preventative interventions. Individuals weigh other less quantifiable risks or influences, including experiences with a history of disease or a family history of disease, the individual's level of risk aversion, generalized anxiety, etc. Moreover, all those who test positive for a deleterious genetic variant that increases one's probability of developing a disease share a fundamental element: uncertainty. Importantly, certain types of uncertainty, particularly probability uncertainty and ambiguity uncertainty, may not be reducible. Genetic testing may exacerbate already existing uncertainty in medicine. Uncertainty also may last beyond an individual decision point, so that an individual must constantly manage inconsistency, ambiguity, and unpredictability. Because medical decision-making is significantly reliant on the doctor-patient relationship, I explore how the roles of the physician and the patient may further shift away from the traditional roles. In many ways, the circumstances of previvorship are particularly prone to shifting the full burden of medical decision to the individual. I recognize physician reluctance to provide certain prophylactic interventions and discuss how the pre-vivor experience may alter the traditional informational and power asymmetries that are inherent to the doctor-patient relationship. Based on this analysis, I conclude that that previvorship exposes the inadequacies of the legal doctrine of informed consent. In earlier scholarship, I recognize that there is a growing consensus that the legal doctrine of informed consent is becoming increasingly inadequate to protect patient self-determination and voluntary decision-making. And the introduction of previvorship to the medical landscape challenges some of the most basic assumptions about the doctrine. The Previvor experience is exemplary of the diminishing utility of the legal doctrine of informed consent to ensure voluntary decision-making in modern medical practice, and it is illustrative of how medical and scientific innovations and the evolving doctor-patient relationship are rendering the legal doctrine of informed consent inadequate to addressing patient needs. Significantly, the current model for informed consent is not suited to encouraging disclosure of and coping with the high levels of uncertainty that are intrinsic to pre-vivor decision-making. Previvorship exemplifies and amplifies the inadequacies of the legal doctrine of informed consent to address the limitations of effective action in the wake of uncertainty. Further, the role of risk may take on increasing complexity in pre-vivor decision-making. Due to the multiple categories of risk, the risk-benefit calculation must be adjusted for pre-vivors. Moreover, the legal doctrine of informed consent is not well suited to addressing non-medical risks and benefits. And then I end this project by looking toward the future. We should begin to envision a legal doctrine that supports a robust shared decision-making approach to truly address individual preferences and values, the increasing complexity of risk-benefit assessment, and inherent and sometimes irreducible uncertainty. And while the shared decision-making model is not new, it is one that is increasingly suited to modern medical practice. It emphasizes how information is communicated. It focuses not just on reducing gaps in knowledge, but also on managing uncertainty. But replacing the legal doctrine of informed consent with a more robust shared decision-making model is not enough. The pre-vivor experience underscores the deficits of the biomedical model of illness. Rather, the biomedical model should be replaced with a new, more expansive and more inclusive model of illness. In many ways, our current legal rules, and in particular, the legal doctrine of informed consent, reinforce the biomedical model of illness by emphasizing the biological over psychological and other factors of medicine. Previvorship, like other categories before it, challenges the biomedical model of illness, underscoring the problems with focusing solely on medical risk. The emergence of previvorship as a medical status highlights the ambiguity inherent to the conceptualization of disease. The biological could not be separated from the psychological, social, religious, socioeconomic, cultural, and personal aspects of the previvor experience. Thank you.